And I'm delighted to be your moderator for this session. We are honored to be joined by two leading brains on the subject of climate change today. Rachel Lowe, ICREA research professor, will be presenting on the topic harmonizing multi-source data to predict the risk of climate-sensitive disease outbreaks. And Victoria Halden from WHO's Epidemic Forecasting and Infectious Disease Strategies Unit will be presenting on the topic Foresight for Improved Pandemic Preparedness. So please feel free to think about your questions, add them in the chat at any time. We will begin with the presentation from Rachel. This will be about 10 minutes, and we will then have the second presentation and open up for a round of questions, answers, and discussion at the end. So please do feel free to raise your questions in the chat, and we will discuss at the closing. Over to you, Rachel. Thanks and welcome.
Thank you very much. Can you hear me okay?
Yes, we can.
Okay, thank you for the introduction. So I'm an ICREA research professor and a leader of the Global Health Resilience Group in the Earth Sciences Department at the Barcelona Supercomputing Center. This is an image of the Mare Nostrum 4 supercomputer, which is hosted in this very nice chapel. You're all very welcome to come and visit us here. And my group works alongside the Earth System Services Group, which aims to integrate climatic and Earth observation information into decision support systems to build a more resilient society. And specifically within the Global Health Resilience Group, we are co-developing decision support systems to predict and understand the emergence and spread of climate-sensitive infectious diseases. So our goal is to try and make use of all the satellite observations, Earth observations, climate reanalyses, forecasts that are available to us, and translate that information into useful and actionable indicators that can be used to guide decision-making on the ground. In terms of mosquito-borne diseases, that may involve deciding when and where to deploy vector control campaigns or educational campaigns to eliminate mosquitoes in and around the home. This is an example of a satellite-based dengue forecasting system for Vietnam that we have developed over the last few years thanks to a UK Space Agency funded project. So this was an international collaboration between research institutes in the UK and Vietnam, as well as WHO and UNDP. And we worked to develop a dengue modeling framework based on the requirements laid out by the decision makers in Vietnam. And we, using a historical database of counts of dengue cases over 20 years for all the provinces across Vietnam, we formulated a series of models informed using different Earth observations, output from a hydrological model. And we also used seasonal climate forecasts to predict change in the climate conditions for 1 to 6 months in advance to produce these probabilistic dengue forecasts up to 6 months into the future. And this information was is displayed every month on this platform, which is accessible particularly to the users in Vietnam. And this gives various options. For example, you can look at the probability of exceeding pre-selected epidemic thresholds. In some provinces, the dengue control teams prefer to work with outbreak thresholds like mean +1 or 2 standard deviation. We also give the option of working with percentiles, because then you avoid the issue of having to remove extreme years to calculate your endemic channels. So we have these different outbreak options that you can look at. You can also visualize the sort of evolution of the dengue season and compare that to different thresholds. And there's also information looking at the verification of the system over the past. So we've also been doing work in the Caribbean, trying to develop climate-informed early warning systems in collaboration with the Caribbean Institute for Meteorology and Hydrology and the Caribbean Public Health Agency. And we've been working particularly with partners in Barbados, with the Ministry of Health and Wellness and the Barbados Meteorological Services. And after several sort of conversations and meetings several years ago, our partners indicated that they were starting to notice a change in dengue epidemiology, and this could be linked to some quite extreme droughts that have been experienced in the islands. Barbados is one of the top most water-stressed countries, and it's also very sensitive to El Nino events. So when we have El Nino events, you tend to get quite extreme drying periods. So we wanted to understand this potential link between drought and dengue. So we formulated a dengue prediction model where we were using the standardized precipitation index, which is an indicator to tell you if conditions are exceptionally dry to exceptionally wet. And we found that using a distributed lag nonlinear model, we could identify increased risk of dengue outbreaks around 3 to 5 months following a dry period, but also increased dengue risk between 0 and 2 months after exceptionally wet conditions. And this information was very useful and interesting to us. Improved the skill of our prediction model. So this did better than using sort of individual lags of the different climate conditions. And we could use this information to evaluate how well this model would have predicted outbreaks in the past. So here we can see for any given month, X marks if an outbreak actually occurred, and the shaded color indicates the probability that our model would have predicted the outbreak. So the stronger the color, the higher the probability. So in areas where we have a cross and a sort of purple shades of color, that shows where the model did well. And we found that in these, particularly in the El Nino years, the model seemed to do quite a good job at picking up these epidemics, not so much in the last year when we also had the emergence of dengue and chikungunya, which may have complicated the picture. And this information about these sort of delayed and non-linear impacts of climatic conditions on dengue have been started to be used, at least in a qualitative way, incorporated into the Caribbean Health Climatic Bulletins. So when there is a drought experienced and then there is a forecast for exceptionally wet conditions, then a warning can go out in these bulletins to be particularly aware to eliminate mosquito breeding sites, particularly in the case of water storage due to drought. So this pattern was very interesting. We wanted to see if we would identify something similar in other locations. We've done a lot of work in Brazil previously. So we had a look at the around 20 years of data for dengue cases in Brazil. Between 2001 and 2019, there was over 3 million dengue cases reported across the country. This here is just showing us how the data is organized by state, again by month along the x-axis and year along the y-axis. So we can see the sort of seasonality and inter-annual variability in these cases. And we can, on the right, we're seeing the same graphic, but for the Palmer Drought Severity Index. So where we're seeing the brown colors, that's showing the drought events, and we can see that they are increasing, and particularly in the north and northeast of the country. So we applied a similar framework, but this time take into consideration the sort of diverse spatial landscape of Brazil. And we found, interestingly, a very similar situation where this increased risk of dengue following drought events with this long lag and then the short lag effect with extremely wet conditions. And when we looked at this across an urban gradient, we saw that this effect of drought was particularly exacerbated in urban areas compared to rural areas. And we looked at some data of reported water shortages, which also displayed a similar pattern, which demonstrates to us that the interaction between these hydrometeorological indicators and the underlying urban infrastructure is also very important. So this kind of information can help us build upon our previously developed dengue early warning systems. So I showed you the example that we had for Vietnam. In Brazil, we also several years ago developed an early warning prototype with the Ministry of Health ahead of the 2014 World Cup, where in real time we combined seasonal forecasts of the temperature and precipitation conditions in the next 3 months and combine this with the dengue surveillance data at the time of our forecast to give us a 3-month lead of the probability of observing an outbreak category from high, medium and low risk. And now using this sort of information that we've gathered from our distributed lag nonlinear models, we would think about how we could incorporate all this information by updating our forecast as we approach the target. And as we get closer, we can start to incorporate observed data as well as forecast data into our model. However, when we looked at trying to implement this through a consultancy we had with the Red Cross, we found that by having to use so many different lags and leads in a real-time system would actually be quite complex. So we're now exploring a framework where we can actually identify the best long lag and short lag indicators and look at the interaction between those. And here we found for Barbados that if we were to observe hot and dry conditions, and then we had a forecast several months later for wet conditions, then our model would indicate a high risk of dengue outbreaks. Whereas if we were to observe cool and dry conditions and then continue have a forecast for continued dry condition, then that would give a scenario of a low risk of a dengue outbreak. And we've been working with the Barbados Meteorological Services to see how this information could be portrayed on the climate service platform of the Meteorological Service alongside their other climate services like Dust Haze, making use of this impact matrix, which can indicate what kind of action should be taken given a sort of high severity, high probability event. So we're looking at adapting this now for the case of dengue outbreaks. So looking at what's the ideal epidemic threshold and above what probability would we expect the vector control teams and other agencies to actually take action. So through a newly awarded project from the Wellcome Trust, we're hoping to develop this sort of these modelling tools, the things that we've been developing to try and predict the risk of climate-sensitive disease outbreak, into an R package that can then output useful information that can be fed into these pre-existing systems. So I gave the example of the Barbados Meteorological Service. We're also working with a nowcasting dengue system in Brazil called InfoDengue, which has its own platform and produces short-term forecast or nowcasts of dengue risk using a variety of different indicators, including meteorological stations. So we want to try and extend this lead time using this approach, and we're also working with the Red Cross and Médecins Sans Frontières to develop or integrate within already existing systems to try and provide these kind of early warnings based on compound extreme climatic events. This is just a map showing the different countries that we're hoping to work with initially. So Brazil, Barbados, where we've already begun some of this work, and then together with Médecins Sans Frontières, trying to see how this kind of framework can complement some of the work that's currently been done to predict malaria in South Sudan, and also working with partners in Nepal to try and develop this as well with the Red Cross. We also have another digital technology award from the Wellcome Trust, and this is really taking a step back and thinking about how we can build robust, harmonized data sets, bringing together all these different types of data from satellite images, and also strategically collecting drone images and weather station data in these climate change hotspots where we want to focus, so we can really downscale and improve the quality of the information we get from these gridded satellite products, for example. So we have a focus on 4 different types of hotspots: cities, the Amazon rainforest, small islands, and the highlands. And together with local partners, we are sort of co-creating these toolkits that should allow users to very quickly and efficiently bring together and harmonize all these different data sets at the same spatial scale, so they can be used for decision making and for building early warning systems to try and understand the risk. This is just an example of the type of drone image that will be collected for. This is from Loreto in the Peruvian Amazon, to give us an idea about how for example, water storage practices may change following extreme events, and particularly in the Amazon, where areas with a lot of cloud cover, satellite images are very limited and they're only valid for certain parts of the year. So by using this kind of drone information, we're hoping we can obtain more detailed information throughout the year. And by combining all the different partners and throughout all our projects, we hope to be able to apply these tools between harmonized IDIC streams and our other projects across all these different countries to test that they actually can be applied in places where they haven't been developed. This is just the poster for a training course that we gave a couple of years ago with the Red Cross about this impact-based forecasting methodology that we developed for Barbados. We're planning to give more of these training courses through our projects and also through a project that we have with the Caribbean Public Health Agency. So please do keep in touch if you'd be interested in these kind of courses. And if you'd like to learn more about our research, the Royal Society produced a short documentary about some of our projects, including interviews with partners in Peru and Barbados. And thank you very much for your attention. Welcome any questions in the discussion.
Thank you so much, Rachel. Fantastic presentation. I'm sure, like me, many questions are floating around in the room. We'll just wait until after the next presentation to really take all of the questions and have a rich conversation. So without further ado, we will now open the floor for Victoria Halden from WHO's Epidemic Forecasting and Infectious Disease Strategies Unit. So Victoria, when you're ready, you can share your screen and we look forward to your presentation.
Great, thank you very much. Is my screen is showing correctly?
Yes, thank you.
Perfect, excellent. Well, thank you very much for having me, and good morning, good afternoon, and good evening to everyone who's on the call. My name is Victoria, as was mentioned, and I work with the Epidemic Forecasting Infectious Disease Strategies Unit in WHO, and I'm going to be presenting today our work on behalf of the team, which includes Nikki Shindo, Margot Mathis, and others. So I'll be sharing today about our use of foresight methods for improved pandemic preparedness and showing how our work drew on climate and environmental considerations as we did our first foresight exercise. So in 2021, WHO embarked on its first foresight exercise for improved pandemic preparedness. In holding this exercise, we really wanted to take our time to step back, come together, and reflect on a lot of the lessons we learned during COVID-19. And we really saw this as an opportunity to think ahead to the future. For the exercise, we brought together experts, leaders, and influencers from a wide range of disciplines and backgrounds to share ideas and contribute to discussions that we held. So throughout the exercise, we explored a breadth of topics to tackle future pandemics and epidemics in the next 3 to 5 years was the time horizon that we set. And in doing so, we really wanted to, as I mentioned, leverage these immediate lessons learned from COVID-19 that could shift our thinking and move us from a more reactive to a more proactive approach so that we could be forward-looking in addressing pandemics. I'll provide a brief overview of our activities in the following slides, but I wanted to highlight early in the presentation that you can learn more about our initiative by checking out our report, Imagining the Future of Pandemics and Epidemics. And this slide will be circulated later. We have some interesting materials you can look in if this sparks your interest. So our foresight methodology, it followed a rigorous methodology to develop scenarios for discussion. Scenarios are key to foresight exercises. They are fictional, yet evidence-based and plausible illustrations of the future. Scenarios really are an invitation to conversations. They're a way to help us think the unthinkable. But to get there and to have these scenarios, we first had to embark on a horizon scanning exercise to understand the global trends and key factors that shape different potential futures. To imagine the future, we need to consider the global trends that have created our current world. So these trends are long-lasting, they're far-reaching, and really trends are products of histories, cultures, and values. So the global trends represent both obstacles to a different future, as well as opportunities that we have to chart a better course. So the trends in our foresight exercise were analyzed using what's called a STEEP framework. And this explores the social, technological, economic, environmental, and political factors that shape potential future scenarios. So in our analysis, we framed environmental trends in particular by considering biodiversity loss, resource depletion, climate change resilience, and net zero, food and water security, as well as the potential of the circular economy. And our work explored how these have shaped our current reality and how they will change and intersect with the other trends in the STEEP analysis to create future realities. So once we had the trends, we then drilled down into key factors. So these are the factors that are driving change and influencing the response in other parts of the system we are exploring as we do the exercise. So for our exercise on COVID-19 and the future of infectious threats, we had 3 broad categories of key factors. So that's the way that the pathogen and host characteristics might drive change in different futures, the role of public health and social measures in shaping change and determining future courses. And finally, the influence of broader contextual factors. So how everything together influencing the specific event we're looking at or the specific threat we're looking at can shape our course. So our work in the contextual factors area highlighted that the impacts of climate change are a key factor affecting the landscape of infectious diseases in the coming years. Based on our roundtables, dialogue sessions, expert feedback, and desk research from the Horizon Scan that brought us the global trends and key factors, 4 scenarios were then created that invite us to imagine the future and challenge us to think creatively about the risks, challenges, and opportunities we face in the next 3 to 5 years. I'll highlight here that scenarios are not meant to be predictions of the future, but they do give us an opportunity to debate and discuss different plausible futures that could occur. So these are snapshots of the key elements of each scenario. Our report has more information, and actually it has a science fiction style story for each. So you might notice that each of the scenario is named after a song. And this is so that as you read through the scenario or read through the story, you can listen to the song and get an immersive experience. So it's all part of this scenario, getting you really into the moment of being within a scenario. But I'll briefly go through. The scenarios range from a future where the world unites to overcome the COVID-19 pandemic, and in doing so, where we create a greener, fairer, and more equitable reality, to on the other end of the spectrum, a scenario where we fail to overcome the pandemic and are faced simultaneously with another disease with pandemic potential. And scenario 2 and 3 are they present futures where we miss the mark to varying degrees. And then across scenarios, our ability to mitigate or adapt to the threats associated with climate and ecological change are included. And I've just, the text is quite small, so I don't assume you'd be able to read it, but I've highlighted below that we must include environmental considerations in our approach to preparedness. And we have included it in our scenario building so that people are thinking beyond the health sector, beyond what is immediate, towards kind of the more long-term intractable issues that shape these scenarios. So through the roundtable discussions and dialogue sessions that we held then about the scenarios, as you can tell, this process was very collaborative, very dialogue heavy, brought in a lot of different people to think differently and creatively and bring in their worldviews about the different stages of the foresight exercise. So we were then able to synthesize 3 overarching guiding principles for future pandemic preparedness based on dialogues around the scenarios. And these 3 pillars were trust, solidarity, and equity, and sustainable development. And then areas of focus that are key in formulating an all-encompassing approach when managing and responding to the complexity of infectious threats. It includes considerations of science, policy, and environment, as well as people and communication, and then others to create this holistic picture. And our outcomes really show from this wheel is where all the outcomes are presented. It really shows the linkages and dependencies between these elements, and that preparedness requires a comprehensive approach to envisioning the future and to taking action to get towards the future that we envision together that we would like to reach. So to learn more about our outcomes, and these slides will be circulated later, you can check out the video that was put together that offers, once again, a more immersive experience to explore the different things that came out of the foresight exercise. And then I'll just share some key learnings that we've learned along the way in conducting our first foresight exercise. So really, foresight methodology is very useful for helping us to think the unthinkable, break down silos, and ultimately to flex our imaginations around some of the key challenges that we collectively face. So through foresight, we have an opportunity to connect across sectors, work together to imagine the future. So foresight becomes a way to build partnerships and practice thinking creatively together and comprehensively ahead of crises. At WHO, we're continuing to advance our use of foresight, so we found it to be a highly collaborative, flexible, and effective method for this type of preparedness thinking and for thinking through different futures. So I want to thank you very much for your time, and you can please feel free to get in touch, and I've left a bunch of links in the document that will be shared that you can check out more. So thank you.
Thank you so much, Victoria, and fantastic presentation to both of our presenters. So if you would, Victoria, just stay on camera. We'd invite Rachel to come back on so we can see and discuss with you. And we're getting a few questions in the chat. So the first question is for Rachel, wondering if the impact in terms of prevention of outbreak of dengue has been estimated and using what kind of methodology. Over to you, Rachel.
Thanks for the question. Yeah, most of the work I've showed you have been sort of prototypes and demonstrations. In Vietnam, where the system has been implemented and has been used, we don't have any sort of formal evaluation of exactly how it's working. I think that's quite challenging to do, and also to actually have that information reported back to the research team, because it's really information that is for the for the Ministry of Health. But there are some activities underway to try and evaluate these kind of efforts using a sort of randomized controlled trials style framework. So sort of looking at particular areas where you can issue forecasts and compare it to areas where you're not doing it, and try and evaluate that way. But in general, I think it's incredibly challenging to evaluate how well these forecasts do, because it really depends. If you do issue a forecast and action is taken to prevent the forecast, then it's very difficult to untangle a successful prediction from a false alarm. So yes, it's a very difficult activity, and certainly something that needs more consideration and work.
Great, thank you. And we'll next go to Yang to voice your question aloud.
Hi, Rachel. It's nice to see you again. Hopefully I'll see you soon in London at some point. My question is, your project is obviously sits on the intersection of many different disciplines. So I'm just kind of wondering, in practice, when you're working with people from disciplines, how do you work around the Dunning-Kruger effect when a lot of researchers just kind of underestimate the complexity of like the area that they're not really familiar with? Because I think obviously interdisciplinary work is very difficult from very basic reasons that like people use different terminology to this kind of stuff. So just kind of wondering like your overall experience in terms of managing this kind of, you are pulling a lot of different sources. How do you make sure that everything is properly understood and nobody's complexity is underestimated or misunderstood?
Hi, thanks, Yang. Yeah, that's a really interesting question. I think probably the key thing in a lot of these projects is making sure that it's very sort of cross-sectorial, and working sort of not only with the health services, but also with the climate services as well, and trying to sort of convene or facilitate as many opportunities as possible for the sort of users, providers and stakeholders of information to work together and understand that sort of like those different workflows and the strengths and weaknesses of each part. So for example, in often the sort of Ministry of Health have all the expertise in about where and how to deploy any sort of actions to prevent the disease, whereas perhaps meteorological services or climate services have a lot of that technical infrastructure to be able to help make any sort of tool or system sustainable and operational. So it's kind of trying to find that balance between expertise, resources, and yeah, so I think it's a kind of a combination of needing not only an interdisciplinary team of researchers working on it, but also a sort of cross-sectorial set of users and stakeholders.
Thank you.
Great. I see that Ruby also has her hand up. Ruby, would you like to come in?
I think Leroy in the chat was already asking a question, or Lester, sorry.
Yes. Do you have a different question, or would you like to read his?
Oh, no, I have a different question, but I'm jumping the queue.
Yeah.
Sorry about that, Lester. So yeah, my question, I have two questions for each of the speakers, one for Rachel. So traditionally with risk mapping, one of the main issues with risk mapping is the resolution. So we often have really great risk maps at a sort of macro level, but there's very little granular detail down to, say, the village or town level. And I was wondering if you'd looked into maybe looking at other risk factors like poverty or construction material, or the presence of slums, that kind of data to perhaps bring a little bit more resolution into the risk mapping work?
Mm-hmm. Yeah, that's a really great question. So in a lot of our Brazil work, we've incorporated many different indicators like access to the pipe water network, rubbish disposal, different sort of socioeconomic indicators. But you're right that it really depends on the spatial scale you're working at. So for example, in Brazil, when we're working at the microregion level, and there's around 558 microregions, the signal of a lot of those indicators is kind of wiped out by the proportion of the population living in urban areas. When you go down to a finer scale, so it could be municipality in Brazil, or it could be the district level in Vietnam, you can start to see a little bit more those changes. And certainly we have a study that we're about to finalize for Vietnam, looking at these different processes at the district level. And we are indeed looking at things like infrastructure type and access to toilets, and to try and understand how the changing climate, both climate variability and climate change, is interacting with these changing urbanization and population dynamics as well. So I think it certainly is very important. When it comes to forecasting, it traditionally have used a sort of coarser resolution, partly because it can be quite challenging to use these rather coarse scale gridded products of seasonal forecasts. If you're trying to predict the climate out 6 months in advance, it's quite challenging to do that on these finer spatial scales. So trying to find a sort of compromise, a resolution, so where you're not sort of having to aggregate or disaggregate your information too much, and introduce additional noise, and that balance between making sure that the risk maps are also useful to be able to pinpoint resources.
Great, thank you for that great reply, Rachel. And we have a few more questions for you in the list. We're going to go to a question for Victoria next. And so Victoria, putting ourselves back in the mindset of your 4 scenarios, I'd like to voice this question, which is really more about the marketing approach that you've taken with your results. And so these 4 scenarios: I love you, I hate you, happy days, here comes trouble, and Heartbreak Hotel, is quite an engaging way of communicating. And so maybe you could speak a bit to the process that went into the design, the marketing, and the ultimate decision to take this kind of a creative and almost fun approach to discuss a really serious topic. Over to you, Victoria.
Thank you. No, that's a great question. And yeah, I think you've really hit the nail on the head with thinking about creative and fun ways to engage and to get people to collaborate and work together and talk through some of these thorny, complex issues. So we had the good fortune to work with a group, Arup, who does a lot of foresight work, a lot of futures thinking work, and takes this sort of really rigorous methodological approach that's partnered with a really great communication style, a really engaging way of thinking about the future. And I think, especially, well, in my opinion, the science fiction way that we wrote the 4 scenarios, what I showed is a snapshot. They each come with a very immersive story, is really useful when you then have to sit and discuss, you know, what your field, what your discipline, what the work you do might bring or might see as a red flag in any of these given scenarios. So I think it was a way to think outside of the box. It brought a lot of people together in very interesting ways, and it kind of pushed people to think beyond their boundaries or beyond the boxes we create for ourselves in applying our skills and applying our knowledge to thinking about the future. So foresight itself is a very engaging and creative methodology. So it really gives you a bit of a license to come at your results in a bit of a fun way, and it helps people to see, okay, this is how it all comes together. This is why all of these horizon scanning exercises, this is what it really would feel like if I was in that future. So no.
Wonderful. Yes, thank you, Victoria. And a follow-up question for you on that point that's come in is how have you monitored how the foresight work has been used at country level for policy or strategy development?
So we are currently developing the next stages in our foresight work, which we'll be working with regional partners and seeing how we can hold different types of foresight exercises. I know that there are governments and countries around the world that are starting to adopt foresight methodologies. The government of Canada is using foresight. So I think there's a lot of potential and a lot of excitement in the future for using foresight and partnering with foresight in these sort of ways, and to consider, how it can be used and how we can work together to use it for policy and strategy development. So a bit of a brief answer, but that's the one.
Wonderful. And next we'll come to Lydia, who has another question. So don't get too comfortable, Victoria. I think this one is for you as well. Go ahead, Lydia.
Yeah, thank you. Thank you very much, Victoria. Amazing presentation and very, very interesting. My question is related to the use of these initiatives for preparedness. So as now we are working together with countries in the updating their preparedness plans, their multi-hazard plans, and also those focus on respiratory pathogens, do you have any experience on how to integrate or use these great initiative into this operational work in the countries?
Sure, yes. The beauty of foresight is it's such a flexible approach that you can take elements of foresight and do a longer project like we did that spanned over many months, or for example, in an upcoming meeting, we're doing a foresight exercise collaboratively within the meeting itself. So it's a very scalable approach. And when you have the basics of foresight, you can apply them in these sort of circumstances for preparedness. You can hold a foresight exercise, and it can really be scaled up or scaled down to the needs. And given there's a lot of different, I just presented on one foresight methodology. There are different methodologies or different ways to come at it. It can certainly be used in a lot of different applications. So I think that's the beauty of the method as well, the creativity, collaboration, and the flexibility.
Great. Thank you so much, Victoria. And we're now going to come back to our other speaker. So Rachel, if you would mind responding to Lester's question in the chat. So he's asked, how are communities in Vietnam engaged in providing information? How useful or essential are community inputs and insights on providing data on scenarios and risk? Over to you, Rachel.
Thanks for the question. So the Vietnam project has been very much developed. It's been a sort of like a high-level project between the Ministry of Health, the different research institutes in Vietnam, and WHO, UNDP, and the platform isn't publicly available. And I think it's not designed to be open. It was chosen to keep it so it's for the decision makers and for deploying. I think there can be a lot of challenges and sensitivities around making this kind of information open. It can impact things like tourism, housing markets, all these sorts of concerns that governments can have. There are other examples where you can have these kind of products open, but they should be, very well tested and verified before that happens. In terms of community engagement in our Harmonise project, we are actually fortunate to be given a community engagement enhancement piece of the project. And this is allowing us to conduct activities within the local communities for which we're hoping to develop our toolkits. So we're particularly engaging with local communities in Pará in the Brazilian Amazon, also in the Colombian highlands and in the Peruvian Amazon. And that involves sort of setting up a consultative committee, conducting consultations and workshops and exercises between researchers, the people conducting the drone campaigns, and the local communities to understand the kind of way they perceive that climate change is impacting their environment, how they actually feel about having drones operating in their environment, having a look at the sort of ethical guidelines that might be available for collecting this kind of environmental monitoring data for health. So it is, incredibly important piece of the research, and when there's an opportunity to conduct the community engagement, then that's very beneficial for the research.
Great, thank you very much, Rachel. And next we'll come to Rufus. Go ahead, Rufus, the floor is yours.
Thank you so much. I think it's more or less the same question that the previous speaker has been asking about the same issue of engagement of the communities. But for me, I'm focusing mostly with the engagement that she said we are working in South Sudan. and also considering the challenges that we have in South Sudan already for ethical fights, this accessibility due to climatic and hydrometeorological challenges during the rain season and these other areas, and already the linkages with the other like rare diseases, and like we are looking, I'm thinking of one of the extreme areas like Old Fangak or Mabani, those areas which are even hard to access. How is it possible or easy to access information, and also in terms of engagement of the authorities? How if effective is the system and the information flow with these partners? Because for me, I'm interested because I'm also working in South Sudan, like I indicated before, and will be much interested to know some of these challenges, because we are also facing a lot of challenges on information collection and data analysis, even just to get information from MOH and the like. It's very difficult. How is it easy for you to access, and which mechanisms are you using?
Yeah, no, that's very challenging. I think it's all to do with this sort of user-driven like co-creation approach to research. So we tend to have developed our projects with ministries of health who actually want, like, they need this kind, they really would like to have some sort of climate-informed early warning system to see how it can work. So that sort of facilitates data sharing, because the public health services really would like to improve their sort of intervention times. So it's very much like a user-driven approach. Also, in some situations, we're lucky, for example, in Brazil, they have excellent open access surveillance data, which allows you to develop, gain a lot of insights from that data, particularly because it's such a diverse country. So yeah, I think accessing the Ministry of Health data, if it's not open, it really has to be through building those partnerships. And in terms of accessing the meteorological data, it can be very challenging. We tend to use these reanalysis products where you can have gridded data around 9-kilometer resolution across the whole globe. You know, the quality of that data is not as high in areas where there is not meteorological stations. So we're trying to understand through this project how well these reanalyses actually represent the local ground truth conditions, you know, in the areas where we do have meteorological stations, to try and understand how they could be sort of used for local decision making in those areas where you are lacking data. So I think just trying to figure out if these sort of global products, remote sensing type products, are applicable to the area you're working in, that can certainly help. And perhaps also taking an approach like using kind of climate indicators. In the Lancet Countdown, we develop a set of climate sensitive infectious disease indicators, which are not based on health data itself, but just monitor, sort of track the changing suitability conditions for a given disease or vector. So that kind of information can potentially help, so at least start the conversation about how environmental information can help improve decision making.
Great, thanks so much, Rachel. And we have a question from Max. Max, please take the floor.
Sure, thank you. And thanks both for the presentations. They're really interesting. This question's, I guess, for Rachel, again, about the early warning systems. This is something that we've had limited experience through our project, just being aware of pilot systems that have been developed using health data from DHIS2 systems in a few different countries. And so I guess I'm curious about how you incorporated the health data and what the connection between that and the climate data was like, as far as process and as far as outputs go. Getting back to the question of data use, what kind of outputs are you presenting the local or district level users with, such that they can take action on the information that's provided? And then linked to that, how have you found the reception of that data from the health authorities? I think we've heard about these pilot projects. There has been some skepticism to taking potentially costly action based on predictive modeling if it hasn't been proven to be effective and reliable. So if you have experiences with that, maybe addressing that kind of skepticism and what sort of actions you've seen that have been taken due to the predictions that have been made.
Mm-hmm. Yeah, thanks for your question. Yeah, I think there's a lot of opportunity actually to link with DHIS2 IS2 and the kind of platform you have, and trying to link that to the climate data. That's certainly very interesting. So I guess in our experience, we've tended to use, like, formulate our models using surveillance data, which might be in the form of counts per administrative unit, per epi week, or per month, or whatever is the sort of like desired resolution. Certainly from a seasonal, if you're using seasonal climate forecasts, that kind of information is produced on the monthly level. You can get sub-seasonal forecasts as well, but that's more of an emerging area. So we tend to harmonize or aggregate our health data and climate data at that same scale. So making sure that we also have some sort of climatic estimate at the same administrative level and time step as the health data. And then we explore things like lags, if there's any important delays between anomalous climate conditions and the health outcome. I don't know if that answers the question about how we sort of link those data sets. We also have to consider the way that we aggregate climate data across administrative units, or have to sort of downscale it. And it could be just like simple aggregation, or it could be taking into account underlying population or topography or things like that. And in terms of outputs, we tend to provide probabilistic outputs. For example, what is the probability of exceeding an epidemic threshold? And those epidemic thresholds are very much user defined, depends on what they're using to monitor outbreaks in their current practice. So usually just seeing when those cases start going above the endemic channel. So we tend to use this sort of like moving threshold based on the endemic channel as epidemic threshold, and seeing what's the probability of exceeding that threshold with hopefully around a 3-month lead time. So I think that information is quite desirable to help with planning. And of course, it's really important to explain the limitations of these models and the kind of information they can provide. They're really just providing what is the probability of an outbreak given this combination of climatic conditions, not necessarily saying, it depends what else is included in the model, about how perhaps you can dig a bit deeper and look at how these climate conditions are interacting with other sort of aspects within the forecasting system. But in terms of usability, often experiences that the users are very interested in this probabilistic information in advance, and then that can be combined with the sort of local risk mapping that's used to control vectors anyway. So like these GIS maps, and knowing where the particular, hotspots, breeding sites are. And in terms of skepticism, I think it's really important to provide very sort of clear evaluation and verification of how your model could have performed in the past. Obviously, that's quite challenging. We try to set things up, sort of do some out of sample predictions, and trying to show, if you'd had given this data except for the year, you're trying to predict how the model would have done. Because these kind of predictions aren't perfect. Climate doesn't explain the whole picture. If you can have information in terms of dengue on things like circulating serotypes and that kind of information, that can help a bit. But again, those other indicators are very hard to predict themselves. So the advantage we have of using climate information is that you can, in certain places, particularly in the tropics, and when you have things like El Nino events, you tend to get more skillful seasonal climate forecasts. And that's sort of the window of opportunity when you can actually use climate information to try and make some predictions in advance.
Great. Thank you so much, Rachel. A follow-up question for you, and then just a note to everyone for your last questions. Please be sure to raise your hand or get them in the chat. We're coming up to the end of the hour. And so, Rachel, what was the process used for selection of the sites for the tool piloting?
That's a very good question. It's really based on previous partnerships, experiences of working together. In terms of Brazil, I mean, I've been collaborating there for around 15 years, so we've built up quite a solid partnership, and there's very good data in Brazil, and it's an excellent test bed to help with capacity building in other countries with a similar setting. So, for example, we working with the InfoDengue platform, which already has a data harmonization process, these working with informing municipal decision makers about how to control dengue. We're also working with the Space Agency in Brazil, who have experience of processing satellite information and using drones. And then we connect with other drone researchers in Peru and Colombia. And in the Caribbean, we've been working over the last few years in partnership with the Caribbean Public Health Agency and the Caribbean Institute for Meteorology and Hydrology, and several projects have emerged where there's usually around 3 pilot countries that are included to try and develop these kind of resources. And then depending on the engagement, the amount of data that's available, that sort of is an indicator about how far we can go with these kind of projects.
Wonderful. Thank you so much, Rachel. Thank you, Victoria. If we don't have any further questions from the audience, I think we can end a few moments early, and it was not for a lack of really rich conversation. So thanks to everyone who's been here with us today. Thank you for the conversation, and we look forward to seeing you in the next session of the IOA Network call.
Thank you.
Thank
Thanks,
you.
everyone.
Have a great rest of your day.
Thanks so much.
Good weekend.
Thank you.